Volume is good for everyone. I'm actually going to go ahead and mute everyone, or if you can mute for me, Kelly, that'd be great. There's a couple that have that aren't muted. But so, like Kelly said, I am a lymphedema therapist. I have been in multiple roles at academic institutions for about over 10 years, academic downtown hospitals. And then additionally, I currently have my own uh, clinic with really great staff that's supporting. So to start, when you say lymphedema, everyone has this idea of what that means. And in usually a lymphedema thought has to do with um, a large arm that occurs after breast cancer treatment. So that is very outdated. It can still happen. You can have swelling in any extremity, but I first want to kind of talk about what we think when we hear the word. So, I have had family members who have had lymphedema of arms and or legs from cancer treatment. And I've watched shows that have lymphedema from other causes. So there's first this idea of what it means to us. And then what I'd like to do is kind of walk through what the lymphatic system is, and then getting away from the term lymphedema and really looking at lymphatic dysfunction, because I will tell you, even a lot of physicians and people that I work with consider lymphedema a swollen limb. And now, depending on where the treatment's at and what kind of treatment, we're not seeing limb, we're seeing more truncal or pelvic. So sorry, I'm gonna answer those questions. And when if you're like, wait, what is she talking about? I hope to answer those questions while we're discussing all of this. So I need to minimize my screen real quickly. Great. So chronic lymphedema has about 3 million Americans at risk for cellulitis. Cellulitis is an infection of the area that happens when we have reduced lymphatic function. And I'm going to go through what that means. So here's just some stats. So there's 650,000 hospitalizations for cellulitis. So my job as a lymphedema therapist is to prevent issues occurring from the lymphatic system, and preventing issues like hospitalizations, like having difficulty finding clothing or function, um, and really make sure that, physical therapy is very inexpensive, and hospitalizations and having issues from this is expensive and affects our quality of life. There we go. So if any of you have heard me talk before, I am really big on preventative care. And in fact, some of the studies that I have been published for and presented internationally on has been talking about surveillance, which means I want to see someone as soon as possible, sometimes even before. I worked at one hospital that even before we knew what type of cancer they had, I was already involved with their plan of care, meaning I was getting a baseline measurement so I know what your function and what the size of your body is like prior to cancer treatment. So less than 2% of patients are getting this kind of care. Preventative care, surveillance, prehabilitation, these are all words that are saying the same thing. But what I would like to do is see a patient as soon as possible, get some numbers so I know when there is change, and I want to give you education, mainly on the fact that I want to see someone when they have heaviness, achiness, or tightness, and we'll go through that. So again, lymphedema, if we're already swollen in a limb or in the trunk, we've got a backup in the system. So I want to be involved from right from the get-go and make sure that we don't have any backup. And if there is one, I know where you started. What is lymphedema? And this is where I always like asking you, what does lymphedema mean to you? What are you, How do you feel about what lymphedema, what that looks like? And I want to challenge what that looks like. So lymphedema is a pump failure. I'm going to show you the system in a moment, but essentially, there are fluids that need to be transferred throughout your body, and we have different systems for different types of fluid. And your lymph system picks up larger particles, which is why they look for cancer in the lymph system. They'll also, the lymph also carries bacteria, viruses, fungus, parasites, which we don't have a big issue in the US with the parasites, but around the world, the biggest rates of lymphedema come from parasitic infections. So when the pump is not able to move this fluid, so it's like this. So when the lymph system can't move fluid, it gets a backup, it distends the system, and then we're no longer moving these large particles. And the problem with lymphatic function is large particles attract large particles. So the swelling changes, and it's different than a post-surgical swelling. But a post-surgical swelling can increase risk of lymph dysfunction. So we're going to go through that in a moment. So I love this picture. I know it's kind of hard to understand, but this is truly what lymphedema is. So in the inflammation, so the normal, the slide on the normal conditions, that bubble is able to move through. In the second, the bubble is distending and moving out, and then we're staying. So the first one, the bubble can collapse and move through the normal conditions. In the inflammation, as it gets large and it stays large and it no longer pushes. So it gets this backup. This is what a leg with lymphedema looks like. And so this is very similar to a lot of my gynecological cancer patients that I treat. We are getting better at doing sentinel node biopsies for pelvic cancers. So the rates of seeing this is reducing. I'm very happy to say that. But we can see more in the trunk and the labia. So like the opening of the vagina for a woman. And then we see a lot of scrotal edema for men that are having more pelvic cancers, the reproductive cancers, prostate and gynecological. So in this type of swelling, it's a large particle swelling, so then it increases more, it attracts those large particles, and so the swelling isn't soft, it's a harder feel to it. So where can lymphedema come from? So I kind of talked about this a little bit earlier. Some of us are born with abnormal lymphatic systems. So I myself have some leg issues with lymph. So I've had to work really hard to do that. And then I had a surgery or multiple abdominal surgeries that made my leg lymphatic and venous issues worse. So we just had to stay on it. Poor veins, which is a vascular issue. Infections, because remember, bacteria, viruses are part of what can overwhelm the system. Biliaris, which is a parasite, and this is the largest region in for the world as to why we get lymphedema, but we don't see it that commonly here in the US. In the US, it really is coming from cancer treatment. It can be self-inflicted, and so that's usually for secondary gain. And so I have the ones that are highlighted and italicized in what I treat a ton of. So this is surgery removes lymph nodes, scar tissue radiation. I also want to add chemo in here too. Chemo can cause lymphatic dysfunction. Endocrine, so really all of our cancer treatments. So this is the lymphedema that you're born with. The first picture is Milroy's, and then the second is acquired, which means something happens to you and then we have issues. So that bottom picture is what a breast cancer related arm lymphedema looks like. And we have much lower rates of this now. But what we do have is increased lymphatic dysfunction leading to lymphedema in the trunk and in the breast. So congenital at birth, that was that first picture of Milroy's. And then we have these, so this is what, when you're born with lymphedema, there can be issues that happens at adolescence, and that usually is a one-sided lower extremity. And then there's some that's later on in life. And again, these usually are one-sided because I'm going to show you pictures of what the lymph system looks like. And then, so secondary lymphedema, this is when it comes from cancer treatment, or a parasite, or something happens to the body and it overwhelms the system. Whereas the first one is the system is not working correctly. It has malformations of the system. I have seen patients who have both of these things. So for example, if and when I get cancer and have my treatment, then I know that my body's at risk because I have some lymphatic dysfunction of my abdomen and legs. And you'll see why in a picture coming up. So this gets really confusing. There are stages for lymphedema that are either 0 to 3 or 1 to 4. But I just wrote them all out as what to, so at the bottom, 0 or 1, depending on which one you're using, is called latent, which latent means like in the background or at risk. So then the second stage, which would be a 1 or 2, depending on the scale you're using, is reversible. So that's when we have swelling that will reduce if we elevate our arm or our limb. And then the third level, let's just say, which is either 2 or 3, depending on the scale, is it's spontaneously reversible, meaning that sometimes when we elevate or we do treatment, it comes down, other times it doesn't. And then the last stage is irreversible, where the swelling doesn't change. The swelling is there and it's now getting hard and causing other issues. So what I can tell you is even at a stage 3 or 4, that irreversible, we can treat and reduce the dysfunction and improve the lymph function. So I'm really big on like, listen, at any time we can do an intervention and we can help one improve their function and improve their quality of life and what they're able to do. So your lymphatic system. What's your lymph system, right? Like there's so much online and honestly, like so much bad information out there. So let's review what your circulation is. So for most fluids in your body, there are arteries that take blood away from the heart. There are veins that brings blood to the heart. And then there's lymphatics that supports our vascularity. We have two systems. You're going to learn all sorts of really fun stuff today. You have two systems of lymph. You have a superficial and a deep. So the lymphatics follows your arteries and veins, and it picks up any large particle that the veins cannot pick up. So here is a drawing of, so all these things work together, and I'm going to show you some pictures of them separately. So the arteries carry blood away from the heart, and it's usually oxygenated. The only time is the pulmonary artery because it's going away. The pulmonary artery pumps deoxygenated blood to the lungs and then oxygenates and then comes in. So if you're ever taking a question or you're on like some game show and they're like, what artery is not oxygenated? It's the pulmonary artery because arteries are always away, if that makes sense, right? Arteries are away from the heart, but we pump blood to our heart to pump it to our half of the side of the heart pumps the blood to our lungs, then gets pumped back to the other side of the heart, which pumps to our body. Our body is just amazing. Our heart is amazing. It's just really, really, really cool. And also, let's see, what else do I want to say about this? So arteries is oxygenated. So then it goes to the capillaries, and we're going to look at the capillary in a moment. So you can see how the arteries come in to the capillary bed, the veins come in, and then the lymph is in the middle. So now the veins will carry deoxygenated blood back to the heart. But the veins only bring back 90% of what the arteries brought out. So this is huge. And this is with a very high functioning system. So like my legs don't carry 90%. My veins don't bring back that because like this is why then the lymph system comes in and it will pick up any solution or any particles that the veins cannot bring back to the heart. It picks up large cells. Large cells cannot go into the veins. So that's why the lymph is picking up all of the junk. We call it protein rich because proteins are the building blocks of bacteria, viruses, parasites, fungus. I forgot somebody. But these large cells. And I used to talk about like how lymph is this high protein, and then people started eating less protein. So I want to not, so I kind of changed how I talked about it, but I want you to know the, that the lymph system picks up these large particles, and they're technically proteins. But it has nothing to do with your dietary effect. So super amazing. There are two systems of your lymph. One, so your arteries, veins, and nerves need to go to our biggest organ in our body, which is our skin. It's protective. So we have a lot of lymph that's right underneath our skin because it's protective. There's also immune response in lymphatics. It's just so amazing, which is why when our lymph doesn't work, we're at risk for infection. So when we are protecting our body, there is the lymph that's right underneath our skin, that's superficial. And then there's also a deep layer that's following our organs and our deeper vascular system in our limbs. So, which is great because we can help improve whatever system is not working well by utilizing the other. There are actually collaterals that go from the superficial to the deep. Super fascinating, super amazing. This is the picture that I wanted to talk about with the capillary beds. So in the blue is, so it's away. So it's honestly, it seems a little weird because like, hold on. Red is arterial, blue is venous. So the veins are picking up. So the red part is sending out the blood flow, going to the capillary bed. There is oxygen and carbon dioxide the oxygen is being used for cellular use. And then the byproduct is carbon dioxide is then picked up by the fluid that's going to be the blood that's going to be moving through the veins. And then right in the middle is the green, that's your lymph. So the lymph is there to collect any byproducts that's not coming through this beautiful little passageway of the blood flow, oxygen, cell metabolism. Byproduct is carbon dioxide and large particles potentially. So carbon dioxide is leaving on the blood that's going back to the heart via the veins, but then anything large is going to be picked up by the green there, which is the lymphatics. I love, love, love this picture. It's so cool. All right, so your lymph system, it's like traveling. Like I'm always like equating it to getting in the car. So it starts with these lymph collectors, which is literally like a back alley, like the little sidewalk that goes to the alley. And then the alleys go to your little street. Your little street goes to a main street. And then maybe, you're now talking about getting onto a highway. So there's all of these different size traveling lymph areas. So sorry, there's a couple really big words on this one. And this comes from a training that I'm doing for other practitioners, other physical therapy. So the biggest thing that I want you to know, besides like this is literally a picture of lymph, which is pretty microscopic. It's very small and it slides and it opens and closes. It's so beautiful. And that opening and closing with the sliding is where it kind of pumps that. It gets big and then pumps, big pumps. In lymphedema, it gets big and no longer pumps and just gets bigger and bigger and bigger. There is connective tissue that is surrounding all of this. I am a physical therapist. My jam is connective tissue. So my job is to fix connective tissue dysfunction to help regulate the lymphatics. So it's so we've got new research. Lymph vessels are all over the body. They say except not in the eye. And they used to say not within the brain, and we know this is false. There is actually, it's called glymphatics. So there's lymph of the brain. It's specialized. It is so cool. It's huge on brain fog, dementia, neurodivergent populations. So we know that we can improve some cognition and memory by improving lymphatics globally because the glymph system is part of the lymphatic system. So amazing. As you can see in this picture, it surrounds our organs. So, and we know that a lot of our organs are affected by cancer treatment. This is the lymphangion. So this is that little microscopic, it's a drawing kind of showing how it's wanting to pump through with these valves. And when there's lymphedema, the valves are no longer opening and closing. So this is all smooth muscle. This is stuff that you can't think of. Like this is stuff that you aren't thinking of. It's like your gut. It's like you can't tell your gut to slow down or speed up, but there are things you can do to improve your gut, right? I just made a little switch over to gut. There's like, we know if we are um, giving ourselves proper nutrition, hydration, and sleep, and our nervous system is doing great, we know that we can improve, how our connective tissue is moving fluids through. Additionally, for lymph, we can use our skeletal muscles, which are really close to that superficial layer. So we can use movement to help our superficial layer push the lymph through better, which is why our treatment is to get the lymph moving, support it, and then give exercise or activity. Also, for the deep layer, this is my most favorite part. So the deep layer is the true mover of lymphatic function. And what is so great about improving our deep layer of lymph is doing deep diaphragmatic breathing, which everyone in my clinic gets deep diaphragmatic breathing, whether you're coming and seeing me for pelvic dysfunction or lymph dysfunction or chronic pain, everyone gets deep diaphragmatic breathing and it affects different systems. So when you contract your diaphragm, it's going to stroke the cisterna chyli. We're going to see that in a second, which is your main lymph processing center. So cool. Deep breathing, you can make your swelling go down with breathing alone. So great. All right, so here's the lymph nodes. This is what was removed during cancer treatment to check and see if cancer got outside of the area. A lot of times patients will be like, oh my gosh, what if, I have cancer, now you're pushing cancer, and cancer is way more complicated than pushing it through the system. If anything, I want to push cancer cells to the lymph, so the lymph hopefully has, the lymph nodes will eat and destroy that cancer. There is research that has shown that your body has seen cancer cells at least 7 times before cancer figures out a way to outsmart your body. And what we know is that when we give cancer to animals, like experimental, like rats, mice in research. So when we give animals cancer, the animals will actually fight the cancer through their lymph nodes. Okay. But we need to know from a treatment standpoint, because then I have patients that are like, why'd they take my lymph nodes? Well, because we need to stage where your cancer is gone to give you the appropriate treatment. And you have so many lymph nodes in your bodies. I should have a slide in here, and I think the numbers are low. So you have hundreds, if not thousands of lymph nodes in your body. So taking those few out, especially if it's a sentinel node biopsy, we need to do to stage the cancer to give you the appropriate cancer treatment. So we can answer questions about that later. So again, this is just showing where that immune response goes. And I know these are a couple really big words. You guys will have access, or you may have already gotten this PowerPoint, but this is just showing how the lymph nodes work and how they help to eat those large cells, all of them, not just cancer, but parasites, bacteria, fungus, parasites. I said parasites twice. Bacteria, viruses, parasites, fungus, cancer cells. Got them. All right. So this is per Gray's Anatomy. Gray's Anatomy says there's 400 lymph nodes in the body. There's way more than that. There are so many. Like it's, everybody has a little bit of difference. So, but these are some of the estimates that Gray's Anatomy did. And so when we're losing a few of them, it's okay. So we don't have to be terribly worried. It does reduce, it does reduce the function of that area. So remember there's those highways. So when we remove that lymph node, it will make lymph function of where that vessel was clearing. It'll make that dysfunctional. So that's why we have that increased risk of infection and cellulitis. So we want to maximize, and there's things that we can do to make sure that this is better. All right. So lymph vessels go to the nodes, and then this kind of goes to how it's going throughout the body. I love this slide. So our body is amazing. It always has these backup systems. So when we have an issue to one of the pathways, there's collaterals between the two. And we can maximize our lymph function by being smart about how our lymph is moving and maximizing the movement of our lymph. So here is a drawing of our superficial. So see the thoracic duct there? That's where we're looking to stroke with the deep breathing. Do I want to say anything else about this? There's not a lot of, for the two systems, it's really emerging. Lymph doesn't have great surgeries or medications. And if you've noticed and it's not like sexy, like lymphatics and lymphedema and lymphedema function, it's not a sexy specialty to have. And there's not a lot of, doctors that are really kind of taking over on this, like medical doctors. There's not surgery or medications for it. There's just not. We are doing some microsurgeries, and there's some lymph node bypass transfers that are occurring, which is absolutely great and fine. So it is coming along. But this is a really under-researched, underrepresented area of medicine. I want to be very clear that we're behind on this. A lot of the ways that people treat currently is pretty outdated. It's from about 100 years ago, so almost more. And so we have newer research, we have newer ways to define what's going on, and how to improve this. So treatment. There is so much education. It can be very, very, very overwhelming, right? Like I understand the reason why we wanted to have this meeting recorded is so you can go back and listen to it as many times as you wanted and have access to the handouts. So you can really learn and get an idea of what your lymph system is like. So our biggest thing at my clinic is we provide so much education, and we're not just educating the patient, we are trying to educate physicians, nurses, anyone who's, patient advocates, any nurse practitioners, PAs, like anyone who's involved with specifically cancer treatment. We want to do manual lymph drainage. This is not lymph massage. This is different. So it's pretty technical. It could be soft, but it may not have to be soft. We have to go to the level of where the restriction If it's a, we have to, we have to go to the level of where the restriction, where the lack of movement is occurring. So we want to move the fluid, get it moving, and then we want a bandage to give it an external support. So this is all physics. So it's called the law of Laplace. And this law, it's totally from physics. So I'm going to use my hands because my arms aren't fitting on the camera screen very well. So if you have a cone shape like this, it's conical, and you have an equal pressure around this cone, which is what the bandage is doing. So it's just, and I want to say pressure. If you have walls that are just the same pressure externally on a cone and there's fluid in that cone, the direction of fluid will go from the small diameter to the large diameter. It's total physics. It's amazing. So that's why we do the bandaging. My bandaging is different than almost everyone else's bandaging. I do a lighter bandage. I do not pull my bandages. And I will do a crisscross pattern because the goal is that the bandages help move the fluid. And so if you have a circular knit, which is straight like this, and what should happen with the bandaging is it should move fluid so then it no longer is filling. So there's less fluid. So now we aren't holding here, we're like this. Well, then if you do the circular bandaging like this picture has, the bandages will just fall right down. So I can tell you that the bandaging that we do at my clinic is different than what is on this picture here. And then compression garments. I do not like over-the-counter garments except for one brand called Solidia because I find a lot of problems with these over-the-counter bandages, excuse me, over-the-counter garments. So that's like the arm sleeve or the leg sleeves. The problem with the over-counter is that it's one piece of thread that goes the whole way. So if you have any areas that are small, you're going to have too much pressure there. And our elbows and knees are small. And then also wherever it stops. So I'm a fan of garments, just specific ones. They're usually lighter and they usually have a little bit of technology to help stimulate the lymph underneath the skin. And I also like the custom garments. So, and then I love pneumatic pumps. I want to teach you how to be independent at home. I want to teach you all about your body and how to fix like the little kind of like these roadblocks, if you will, that we're having because of cancer treatment and how you can manage it at home. Come back and see me as needed for like little tune-ups, but I want you to be independent with what like how to make your body happier and move better, the fluid to move better. So for management, again, in education, it's all about self-care, reducing infection, different soaps that are better for you, how to do some of the self-MLD, using compression. Again, that's in moving fluid from the smaller to larger diameter, not with being like squeezed or overpressure. Because think about it, if you have too much pressure, your system can't contract and relax. So, and that's the problem that I have with the over-counters, the over-the-counter garments that will occur. And then I want you to have that compression and I want you to have activity. I want your muscles pumping. So that's going to help your body. And then pneumatic pump. So hopefully if you're like watching TV or like reading or doing audible or you're just resting, you can put your pump on and just have that pump move. We start closer to the center of our body and then move the fluid wherever the backup is at. So I always equate it to like a traffic issue. Like you can't start where there's the most congestion. You have to unpark the cars that are ahead of the congestion so wherever the congestion's at can move without hitting more traffic. This is from one of my trainings for when I'm teaching how to do lymphatic drainage. So proximally means closer to the center. So we're going to drain closer to the center, even though that may not be where the congestion's at. And then we work further out. And then, so we clear these fascial restrictions. So that's when I showed you that one slide that has the connective tissue. because sometimes stuff is just stuck to itself, scar tissue, radiation fibrosis. Sometimes I gotta break that up and it pops and makes noises, and it can be like very painful if there's a nerve ending in there. And patients will be nervous about that because, they might associate pain with the cancer, where it's like, nope, there's a trapped nerve ending here. Then I want to open up the nodes and then drain the lymph so everything is moving. And then always the pressure of my technique is dependent on the tissue that I need to drain. So if you've gone to some place that does that itty bitty skin stretch and it's not working, that's because we weren't at the tissue that needed to have the fluid moved. There are anastomoses, and this means making connections. So when there is a quadrant that is no longer working, I can move it to another quadrant that will pick it up. Our bodies are so amazing, and we can get them to heal ourselves. It's just so cool. I enjoy using, whether it's for a majority of our cancers are reproductive because reproductive cells want to multiply. So there's less breaks on our reproductive cells. So I work on a lot of breast, gynecological, and prostate patients. And I try to use all of the anastomoses in the back because it feels like a back massage. And you guys have been through enough. And so I like it so you kind of buy in and you want to come in because it feels good because I am using the pathways in your back to help move that fluid. And it's skilled. I mean, I can teach you how to move it in the front and you can do all your front movement because your hands can get to the front. Your hands are not going to be able to get to the backside and move that fluid. So that's why if an insurance company is like, well, why can't you do that? Well, I got to push in the back and they can't push their fluid through the back. All right. Breast and truncal lymphedema. This is incredibly under-researched. About 8, 9 years ago, I created the first protocol that I'm aware of that moves fluid and lymph dysfunction of the breast and the trunk. I've got many stories. I won't tell them now because of time restraints, but I have been very, very loud and vocal about the fact that if there is cancer treatment that's near that has worked on either your breast or your pelvic area, we need to be comfortable as practitioners. If I'm a physical therapist, I need to be comfortable to look and treat that area. I need to know, is there infection? Do we have an increased risk of infection there? What's the scar like? So I have worked with a lot of cancer specialists that really are only doing ortho. They're looking at joints. They're trying to make the shoulder work better. When in fact, if any of you, if you're sitting there, go ahead and take your hand and go underneath your armpit and hold the skin underneath your armpit to your chest wall. Hold it. And then look at how much rage I have. So if I'm holding my skin to my trunk wall, my arm only goes here. There's scar tissue restrictions. Or if I was irradiated here and my radiation has everything tightened here, my shoulder is not the problem. It's not the fact that the ball and socket joint isn't moving. It's the problem is that the scar is not letting me move my arm. So I've got to work that scar. So it's just, it blows my mind when I see like really well-intentioned, smart therapists not knowing what's going on with the patient, where they'll give them all sorts of exercises for their joints. It's not a joint issue. We have to figure out what's causing the dysfunction. So breast and truncal, there's a little side note. Breast and truncal lymphedema, this is so under research. People are not looking. The breast gets full. The breast tissue does not have muscles. The muscles are on the rib cage, not in the breast. So we have to make sure that fluid is moving because we don't, anywhere else in our body, we have muscles that the contract, relax can help push on the lymph to get the fluid moving, not in our breast tissue. So we've got to use external pressures to move that fluid through. So you'll see all of the treatment protocols the same in all of these. So pelvic lymphedema, this is the swelling of the labia or the vulva and the scrotum. Labia is for women, scrotum's for males. So we need to be able to drain that tissue. There's nothing more uncomfortable than the breast, labia, or scrotum being congested. And I have worked with lymphedema therapists and I have worked with pelvic therapists, and I will tell you that pelvic therapists are the best at being comfortable and knowing how to move the swelling. Um, Here are some of the quadrants. So the legs are actually divided into two, like there's a left side and a right side, but the left upper extremity and both legs are on one system and the right arm is on its own. This is actually old. We know that there's some draining that's occurring in the head separately too. So this is, this there is a lot that goes on with lymphatic function. And so I hope each and every one of you find somebody who can kind of look into what may be occurring in your body and really trying to figure out where are the issues stemming from? How can we move it better? How can we get your system more intact? So like that, what is it called? I don't watch TV because I was essentially raised Amish. My 500-pound life or something like that. The lymphedema that occurs in both legs can occur from too much weight on the body pressing the lymphatics. So this is called phlebolymphedema. And this can be an issue with venous. This can be too much weight externally pressing on the lymph. So remember that pumping mechanism isn't happening. This is different than our cancer treatment. Cancer treatment, lymphedema, there's so many things that can be going on that each and every one of you, when you come into my office, we are trying to figure out where, what, why, how. Phlebolymphedema is actually pretty easy, but it's, and because the lymph is not moving, we have increased wounds and that chronic venous insufficiency. That's what CVI stands for. So this can be an issue. I have seen this happen chronically for cancer survivors where they don't get treatment and it actually looks like a phlebo, but it started from their cancer treatment. And that's always really fun when a patient comes to me and we figure this out together as to kind of, sometimes it's just really nice to know like the whys. And sometimes it's hard to say whys. And then other times it's like, oh, look at, how come we've never talked about the radiation that you have to your pelvis for your prostate cancer? And then what that did to the lymphatics. All right, so for treatment, you really do want a certified lymphedema therapist, and this is within therapy. So it's a speech therapist, physical therapist, or occupational therapist. Our training is different than what you might find with massage therapy. Massage therapy, it's just different. It's not going to be, it's not going to be at the level of what a rehab professional can provide. It's good. It's good for everyone. I think if somebody was like, should I get a lymph massage? Sure. But it's not going to dive deep to know what's happening, and it's usually pretty light. Massage therapy is not covered by insurance. Rehab is covered by insurance. So PT, OT speech is covered by insurance. So I get questions about this all the time, and I will tell you that there isn't a one size fits all, but I can tell you what is clinically relevant if you have a lymphatic dysfunction that is severe, right? So if there is a real issue going on in your body, these things here will not cure you. Rebounding, it goes through like this is when you have the tiny trampoline. I need to add the shake board. Like right now, everyone's like, lymphatics, get on the shake board. Like maybe if you have, like maybe it'll help if you have a functioning lymph system, maybe. But even then, there isn't enough time for contract, relax for it to be really, truly moving lymph. So again, everybody wants an easy fix. They want one exercise to do. They want some tool. And from this, it's not evidence-based. I'm so sorry. It can help in general, but it's not going to fix a problem if a problem is there. So dry brushing also, again, that's very superficial. Dry brushing is when you are moving lymph underneath the skin. So um, it can be part of your it can be part of your treatment. Like I will work with every patient and what they feel very passionate about. So if somebody's like, I want to do essential oils, okay, like let's include that in your plan of care, but you need more than these things to help treat you. Modalities, infrared is super big, cold laser right now, red light therapies, super trendy. Supplements, dietary changes, and then, that general lymphatic massage, it's not going to treat. I'm so sorry. Like, I wish I could make things easier, but if there's an issue, we need to go big on it. This is what is, evidence-based. So, perfect. So, deep diaphragmatic breathing. So here's my clinic. We just had a name change. We're now AccuRehab Med because we have acupuncture, rehabilitation, and we have nurse practitioners. And then here is a link to deep diaphragmatic breathing. So you guys can do this at home. And this is when I want to open up for questions. About 10 minutes.